So I'm joined here today by Dr. Elias. He's a gynecologist and specialist. Where are you practicing at the moment? A bit about yourself.
Hi everyone, my name is Elias Abi Khalil. I practice at Kemoso Medical Center. I'm a consultant OBGYN and I subspecialize in advanced pelvic surgery.
Okay. So how many years have you been doing what you do?
Well, I graduated 7 years ago and I've been in practice for that long.
Okay, and in Dubai you just recently moved here, right?
Moved. It's been 5 to 6 months here.
Enjoying it?
Yes, amazing.
Okay, so we've got some questions that some people might feel uncomfortable asking or too shy or anything like that. So we're just gonna get them all out in the open here. So in case anyone's too shy to ask their ob-gyne. So the first question is, how can you make a gynecologist comfortable for your patients, especially because you're male? Because there are male and female, aren't there, ob-gynes? So yeah, how do you make your patients comfortable?
So first thing I'm going to talk about my own experience, and I'm sure most gynecologists share the same feeling.
Okay.
Of course, being a male gynecologist puts it at a little bit of a disadvantage when it comes to gynecology, because it's a very private specialty.
Yeah.
However, you adapt to this and you make it your advantage. For example, when you always have this constant idea in your head that you're a male gynecologist, you're always extra careful about the words you want to say, always extra careful about how you want to examine someone, how to make them feel comfortable.
Yeah.
And with years, you acquire actually good habits, and it becomes very natural for you to just have good habits and make people at ease.
Yeah.
And it all starts with being respectful at first, respecting a patient or a woman's time. They're taking their time, leave their job, their world actually to come to see you. So you have a lot of gynecologists think about that they want to be punctual. However, sometimes they cannot do it. And I think the easiest way is to apologize and be truthful with the patient. Other thing is to be hospitable to a patient. It's like receiving someone at home, you know, welcoming them, calling them out to come into your office, inviting them, standing up, making this whole office theirs for the next 30 or 40 minutes. And that's a very important thing. Now, after that, you have to build that connection with the patient. And building this connection within the few minutes that you have. And it's basically any interpersonal, skills. You have to look them in the eye, be attentive, not like answering your phone calls during the interview or like typing on the computer or interrupting them. Let them speak. They're coming to actually talk to you and not to listen to you speak. It's all about them and not you.
Okay.
Now, the hardest part is when we move to the exam.
Yeah.
The exam part is what people find it difficult, especially at the male gynecologist. But they have to know that first, there's always a third party in the room, and it's usually a female. The purpose of having a third party is first to help the gynecologist. Second is to make the setting ambulatory, and that makes it less awkward. Okay. And another thing is you're always covered. All your body parts are covered. Okay. And when we need to examine one spot, we only uncover this one spot. For example, if we're doing a breast exam, we want to examine the armpit. Okay. We uncover this armpit, we examine it, and then we cover it again. Then we move to the other part. If you want to examine the other armpit, that's what we do again. If you want to examine the abdomen, we only uncover the part that we need to examine.
So we're never fully exposed. We don't feel vulnerable.
You're never fully exposed. You're always fully covered, except the spot that you need examining. So now the most difficult part in the physical exam is when it comes to the pelvic exam.
Yeah.
And that's very important to explain to patients before doing the pelvic exam. Explaining what their feeling is going to be. They're going to feel touches. They're going to feel pressure. If they're going to feel pain, you have to tell them before this happens. Okay, not when it's too late and this thing is happening. Also using your words very carefully to make it less awkward. For example, I'm going to give you a very, very simple example, all right? Instead of telling someone, please open your legs, okay? Then the easier and the better way to do, relax, breathe, and let your knees fall apart, okay? Or let your legs fall apart as much as you can. And you don't have to do it once at a time. You can do it in stages, and then we have the time for you to be comfortable before we do anything else.
Does your practice, do they tell the patients before they come in, you know, like some people might be worried about having to be groomed beforehand, or like obviously you're a doctor and I'm guessing that you've seen everything before, so there's no reason for us to be shy. I mean, you've seen everything, right? So, I mean, do we have to go for a wax, or is that essential to go to an ob-gyne appointment, or?
So during a pelvic exam, okay, the first and most common symptom that a gynecologist sees is vaginal bleeding. So for us, it's like going to a dentist with a cavity, you know?
Yeah.
So, and vaginal bleeding will happen whether you have your period or not. Because anytime you do a pap smear, you're going to bleed a little bit. So for us, bleeding, we don't even see it. So you don't have to be shy that you're on your period, or you have some spotting or anything like that.
Okay.
Because this is part of the routine for us.
Okay.
Now, of course, if you're going to have a pap smear, better not to have your period. But don't feel that don't feel that you need to be embarrassed in front of gynecologists, because vaginal bleeding is very common. The other thing that is grooming, as you discussed before. And yes, grooming, you don't have to groom. For us, pubic hair is like armpit hair. It's part of the normal anatomy of a woman.
Yeah.
We are expecting to see pubic hair. You have to be groomed as appropriate, as you feel comfortable. It's all about you, and it's not about the physician.
Yeah.
We adapt to what we see, okay? And this is through the years of practice, we have adapted to seeing pubic hair. And for us, it's very normal.
You've seen everything, so there's no need to be
Now,
shy.
another thing that is important, people worry about the odor, okay? Like, I don't want to go, I have a little bit of smell. There is no intimate part that does not have a smell, whether it's healthy or not. It's part of the ecosystem of the human body. It's like the digestive tract, it's like the oral cavity, it has bacteria. It has to have a smell. And that's why you shouldn't be worried whether it has a smell or not, because we know it's going to have a smell. So it's fine.
So it's normal, yeah?
It's very normal. Even if you have a smell, that's part of the norm.
Okay.
Now, one last thing I want to add to this is how to give the patient control of their decision making. For example, we're done with the visit, okay? She has a problem. You give her all the data of all the options that she has, okay? And which route is, what are the pros and cons of all the options. But you give her the chance to choose the option that she wants. You don't impose your opinion.
Okay.
You are there to give them the medical information. And when you don't impose, you let a woman take control of her own body. For example, like having her have a birth plan.
Yeah.
And having the birth plan, she will take control over what she wants and how does she sees or foresees her delivery to be. She wants natural childbirth, she wants a C-section, she wants a vaginal delivery. And all of these, you're there to guide them and give them information, but at the same time, you are letting them choose what they want.
Yeah. So with the choices, do you also say, like with childbirth, so of course it's the woman's choice, but then you talk through, like, in case of an emergency, then you may have to intervene and the woman may have to have a C-section, or, you know, like you go through all these options just to prepare. Is that right? Or
we go through all the scenarios.
Okay, yeah.
So even if we're decided on a vaginal delivery, for example, we go through all of the scenarios. What would be the scenario that would push us to go for a C-section? And I mentioned them to the patient. Like, if it happens this case or that way, or you're having bleeding, or you're contracting, or whatever the scenario is, she will be prepared fully of the global picture of how she's going to have this experience. Okay? And always in medicine, you have to have alternative routes.
Yeah, of course. It's good to be transparent, isn't it?
Yeah.
So another question is, how can we approach you as a gynecologist to talk about intimate questions or intimate issues or concerns that someone might have when you're, like, before, during, or after being intimate with a partner?
That's actually a very important question. It's very hard to know how to, tell your partner about your intimate issues.
Okay.
For example, if you have an infection or previous infection or anything like that. And that's a very hard topic that we see every day, because really people are not trained to approach their partner about these topics. And the way I think about it, and I tell my patient, is you have to simplify things.
Okay.
Normalize the discussion. For example, you know, I got into the habit of every time I meet someone, I go test myself.
Okay.
Do you want to go test yourself with me, or do you want to come with me to the gynecologist? I have the habit to take my partner with me, and then at the gynecologist you can lead the conversation. So normalizing the discussion and providing mirroring. It's called mirroring when you provide your partner with things that you do, or you provide the test results or all of this. It makes it less awkward for them to actually go ahead and do this with you. Okay. And a very important topic these days is about pap smear and HPV test.
Okay.
And basically, HPV is a virus that is transmitted through intimacy. And this virus, we test for it now when we're doing the pap smear, and we're getting a lot of positive results. And women don't know how to relate this to their partner. They don't know how they acquired the virus, or did they acquire it through their partner, or they gonna give it to their partner. So that creates a little bit of a stigma for them. And we help a lot of women deal with this thing and help them how they're going to disclose it to their husband.
Yeah.
Sometimes you ask the husband to come to clinic with them.
Okay.
But as a general rule, okay, you should not ruin your relationship over a pap test. Okay. Many times these viruses stay dormant for years, and then they are awakened at some point for your immunity.
Right. So it doesn't necessarily mean that during that relationship someone has been unfaithful. It could just be like something's triggered.
So before you be emotional about it, just ask your doctor. Make sure you have this discussion with your physician so that you take the necessary step and the right decision.
Okay. And you've got some little props, haven't you, to show us?
Yes.
We've got some gadgets, and I'm going to try and guess what they are. I've had 2 babies, both really different births, and several ob-gynae appointments. So let's just take a look. They look quite scary, don't they, when you look at them?
So this is the most common gadget that we use.
Okay.
And if you look at it, it's plastic. It's very clean. Okay. Guess what that is?
So I know what this is a spectrum, right?
Okay, it's a speculum.
Speculum.
Yeah, so we use this. It looks a little bit weird, like a duck, but we use this just to open the intimate part so that we can see the cervix and do a pap smear. And this thing, these two are basically cyto brushes, and we use them to collect cells from the cervix, which is basically the opening of the uterus, and that's by these we do the pap smear.
That's that little scratch that you feel, right?
Scratch. And this will cause you to bleed a little bit. So don't worry if you have a little bit of bleeding. This instrument looks scary, but it's not actually. It's just to hold the thread. If you have an IUD contraceptive, we just hold the thread and then pull it out.
Right, okay.
It doesn't touch you in any way, it just holds the
So do you put that inside that one?
So when we open this, this is what we're seeing. Okay. And then all the instruments go through that. So you're protected by the 2 blades of that, so that we don't.
So it's not rubbing on anything yet. Okay.
Now for babies, okay, you know, we talked, me and Yasmin, about having assisted delivery, and there are 2 ways of having that. Either the vacuum, and you see this little round pressure thing that
I've never
goes
seen
onto
one of these before.
The head of the baby, and when you basically compress these, the pressure goes up, so it creates a suction on the head there, and then you can pull with it. You don't really pull, you just guide the head.
Oh, okay.
Okay, so you guide it right and left. You don't pull because you don't want to hurt the baby.
Yeah, of course.
And what people don't know is just a guiding device.
Okay.
The baby's not coming out. This is, see, it's very small. It's not going to keep it out, And then these are, they look very scary.
I've never seen these before, but I have had
forceps.
Yeah, I've had a forceps delivery, but I've never seen.
Yeah, so these are forceps. They look scary, but they're actually a very gentle thing. And they're also used to guide the baby's head out. They're not used to pull a baby. They're not used to put pressure on the head. No, it's just the way this wraps around the head of the baby, okay?
It doesn't hurt them or anything.
I mean, anything has complications in medicine, but if you do it the right way, it shouldn't hurt the baby at all. And especially if you don't put force. It should be very gentle, and it should come around the baby, and with it, we just guide the head out. Okay. We can't do it alone. The mother has to push the baby.
Yeah, I had forceps on my first delivery. My son was, I was told, this was in London, was told to push. And then after the delivery, he had like a little a little mark here,
Yeah.
a little mark here.
Yeah.
And they said, don't worry, it's just from the force, you know, it's just where we helped him to come out. But apart from that, he's fine. Yeah. But I've never actually seen, it's interesting to see the instruments, because
I mean, sometimes, you know, when we use the forceps, we make sure the mom doesn't see it.
Because it looks
you're saying that and you're in labor. And please take it away from me.
Because you're in a state of panic and
100%.
emotional state anyway. So but it's really interesting to see the instruments there. And if anyone has any questions or they want to, I don't know how you could do it anonymously on Instagram, but if you want to send us some questions, we won't mention your name or anything, and we can ask Dr. Elias after, and he can always pop on and answer some questions. Yeah, it's been really interesting. Thank you so much.
Thank you for having me. Thank you for the Mumz Academy.
Thanks for watching, guys.